Well, good afternoon, everyone, and welcome to Centennial Hall. We're going to go ahead and start on time. Appreciate folks coming out, and I'm sure there'll be folks trickling in. It's a beautiful day, so it'll be real. I really appreciate that people took the time to come here and listen to this presentation. I just want to kind of housekeeping stuff. My name is Terry Tibbett, and I am the moderator, the host, the coordinator for the event, and the organization that I work for is AK Advocates, and there's some business cards back there. We work with people who getting their voices to policymakers, getting their voices heard in the community, and that's you can learn more about AK Advocates if you go to the website. And again, there's not only my business card, but there are other business cards of the people who are working, who are on the panel tonight. Also some brochures from the organizations that are represented here tonight, and also some fact sheets about some of the materials that are going to be talked about tonight. So it's going to be a lot of dense stuff, a lot of numbers and things going on. So those fact sheets are back there to help you remember what you heard here tonight. Everything on that table is based on what you're going to hear on the panel. And well, so with that, just the format is the panelists are going to speak. They're going to give a little bit of, I'm going to introduce them briefly and then sort of give everyone an overview of what is Medicaid, what is Medicare, what is the health insurance marketplace, and what is H.R. 1, the reconciliation bill, just kind of some housekeeping stuff. And then when I'm done with it, I'm going to turn it over to the panelists. And just letting you know who those panelists are. Shannon Hendricks, she works for Southeast Alaska Independent Living, and she's going to speak on the panel first after we do the housekeeping, after we do the introduction. Kim Champney with the Alaska Association on Developmental Disabilities is next to her, and she's going to speak on topics that impact the demographic she works with. Will Jemison is the executive director of JAMHI Health and Wellness. They work on primary care and behavioral health services, and he's going to give you more background on what they do, but also the impacts of the bill and some of the changes that are happening at the federal level. And last on the panel is Anton Rieselbach. Right? And he works for Juneau Economic Development Council, and he's going to speak about the health insurance marketplace and some of the changes related to the enhanced premium tax credit that is on the table. Okay, so with that, we're going to hear from them more deeply here in a minute, but first I just kind of wanted to give everybody the basic health coverage, federal health coverage 101. Those are our panelists, who I just introduced, so I don't need to go over that again. Okay, so what is Medicaid? Everyone in this room may know it already, but for the one person that doesn't know the difference between Medicaid, Medicare, what is Medicaid? Essentially, it's a joint federal and state program that provides health insurance for low-income adults, for children, pregnant women, elderly adults, people with disabilities, and former foster youth who are unable to afford basic and long-term health services. In order to qualify for Medicaid, you have to have, you must meet some income limits, and you also must meet one of the categorical requirements, which is, an example is age, pregnancy, disability, family status, and just letting you know, 38% of Alaskans get their health insurance through Medicaid in Alaska. So if we switch over to Medicare, what is Medicare? Again, now this is a federal program that doesn't partner with the state, that it's basically health insurance for people aged 65 and older. Medicare is also available for people with certain disabilities and people with end-stage renal disease. Depending on the plan, some recipients pay a monthly premium, others do not. So Medicaid, Medicare. And last on the list to give the overview is the health insurance marketplace. And this is an online platform which is also accessible by phone and in person. And it was created by the Affordable Care Act that was passed many years ago. The marketplace provides individuals and families the opportunity to shop for and enroll in health insurance plans that are provided by private providers, private insurers like Blue Cross, Blue Shield, United Health, Aetna, etc. Additionally, the marketplace offers financial assistance through something that's called the premium tax credits. Credit? Plural, or I always get that wrong. And they also work with cost sharing reductions too. So we're going to hear more about all those things here from the panelists. But I just kind of wanted to give you the basic foundation for what these programs are. The H.R. 1, the Reconciliation Act, passed July 4th at the federal level, and it's also known as, well, again, its official title is H.R. 1, but it's also known as the Reconciliation Act, and it's a federal statute that was passed by U.S. Congress early in July of 2025, and it contains provisions related to taxes, tax changes, immigration, defense spending, debt ceiling, Medicaid, Medicare, and the Affordable Care Act, including the health insurance marketplace. So that is what H.R. 1 is essentially what it is. And then, again, the panelists are going to talk more in depth about some of the impacts from H.R. 1. Some of the key impacts, I just highlighted them here. They're going to be discussed in depth. There's changes to Medicaid financing, that's in the bill. Work requirements related to Medicaid and food stamps, that's in the bill. Eligibility changes happened, that's related to Medicaid and food stamps, or SNAP. Its acronym is SNAP. Price negotiation program related to Medicare. We're going to be hearing about the expiration of enhanced premium tax credits related to the health insurance marketplace, the elimination of the automatic renewal for health plan coverage, elimination of conditional eligibility for coverage during the verification process, and that is related to the health insurance marketplace. And then we're going to hear something about the Rural Health Transformation Fund, something good that came out of the bill. We end on something good. So anyway, that's sort of what we're going to hear about today. Everybody's going to go into depth. We're going to start with Shannon, and I want to just introduce everybody to Shannon Hendricks from SAIL. She can introduce herself a little bit more, talk a little bit about her organization. And just to let you know, we're not going to take questions from the audience tonight, but if you do have questions, the contact information for all these panelists is in their information on the back table. You can grab something, you can email them or give their organization a call, and you can ask more questions. Okay, so with that, let's go ahead and introduce Shannon, and you can introduce yourself. I've got here's some sources, sorry, if anybody wants to see what those previous slides were referenced. They came from these sources. Okay, so Shannon, I'm going to get your slide up. There you go. It's all you. Oopsie. Okay, one more time.
Maybe can I operate it from the
There,
computer?
I did it. It's up. Okay.
Perfect. Thank you, Terry. And thank you all for being here on a beautiful Juneau sunny day. Really appreciate everyone showing up and being a part of this. The panel, I know we've worked hard on this and we're excited to share what we've prepared. So as Terry said, my name is Shannon Hendricks. I'm the Juneau Program Director at SAIL, which stands for Southeast Alaska Independent Living. And just a little overview of SAIL, because I think it provides some reference for the lens on which I'm sitting up here on this panel, is we work to empower seniors and people with disabilities to live as independently as possible. We define disability really broadly. So a lot of times when people think of disability, they think of developmental disability. There's a lot of things that fall under disability, from substance misuse to mental health to physical disability. So if an individual self-discloses having a disability, we will work with them at SAIL. We work with over 2,000 people in Southeast Alaska, and we've been around for the last 30 plus years. And we have 7+ offices across Southeast. Our biggest office is in Juneau, but we are Southeast Alaska focused. Perfect. Okay, perfect. Thank you. Yeah, so a little bit of an overview of what SAIL does. So tangibly what that looks like is our 4 main services, which is information and referral, advocacy, peer support, transition services, and independent living skills. And I think the first two are the ones that I'll focus on tonight because I think they relate the most to the topic that we're discussing. And these programs that are listed beneath is kind of all of the different programs that we offer at SAIL, but the two that these mostly touch are the first two that are listed, which is the ADRC and DDRC, which are sister programs. They stand for Aging and Disability Resource Center and the Developmental Disability Resource Connection. And those two programs assist individuals on getting on the Medicaid waiver. In addition to these 5 core services, a lot of our work is system advocacy and system navigation. So we, a lot of times, are people's first call. When something happens in their life or if they don't know where to turn, they'll call SAIL offices and just start telling us about what's going on in their life. And if we can't support them, we try to be a partner in the problem solve in connecting them to the resources that can, and being along for that entire journey of figuring out how to best support that person. So I have a pretty broad perspective. We're very consumer driven and consumer directed with our community. And a lot of things we're hearing around this bill from people in Southeast is a lot of fear and a lot of uncertainty and a lot of stress. So wanted to spend the next little bit just talking about the things that we know, because I think when people are fearful and when they're stressed, it's helpful to think about the pieces that we know and what we can control. So the first part, just to highlight just the bill influencing Medicaid, which Terry already talked about some, is that there is this new piece of the bill that there will be contingencies on meeting and regularly proving work activity requirements to have your Medicaid covered. But there are some eligibility exemptions. One thing also that we know is that in the state of Alaska, this doesn't start until December 31st of 2026. That's not the case for all of the states, but for Alaska it's delayed, and there is the ability to extend this deadline through December 31st of 2028 if Alaska demonstrates a good faith effort to comply. So the next slide is on other things we know, which are exemptions that are part of the bill for Alaskans. So they're all listed here. I'm not going to read all of them, but to highlight a few, American Indians and Native Alaskans are exempt. And then specifically for our SAIL consumers, it's caregivers for elderly individuals and adults with disabilities, veterans, and individuals who have physical or intellectual developmental disabilities are also exempt. So many current Alaskans enrolled in Medicaid should not have their Medicaid affected, but that's not the case for everybody. So there's a big question on how are these going to be implemented? How is this bill going to be implemented? And then also, how are the work restrictions, how are these exemptions going to be administered? So the next slide, yeah, perfect, thank you, are some of these questions that we're commonly asking ourselves and that we're going to need to navigate in the coming years as we look to implement the bill as a state. So how is the state going to determine these exemptions? What does this process look like? Who's going to have the credibility to give these exemptions? With the Division of Public Assistance, which is the agency that processes the Medicaid and SNAP applications now, it's already very behind. What does this mean for this agency now that things are going to be changing and more complex? Is it an opportunity for improvement? Who will take on this administrative burden? How will the state monitor working hours for individuals who are Medicaid recipients and need to meet these work requirements? So there's a lot of work in the next couple of years to be done. But looking forward, SAIL, we're going to continue to be here. We've been here for 30 years. We're consumer directed. We're going to be here hopefully for 30 more plus years in the future. We're going to be a community resource. We want to continue to be the first phone call for our consumers to navigate the murkiness and the uncertainty of our current environment, and so work alongside them to be partners in the problem solve. We want to continue to be advocates in our community, both for our consumers at the local, state, and federal levels, and just be consistent source for our consumers as they continue to navigate these changes. Thank you.
Ready for me? All right. Thanks, Shannon. That was a good start. Again, thanks for being here. My name is Kim Champney, and I am the director of the Alaska Association on Developmental Disabilities. And I love being here because usually I'm talking to statewide groups and not my own neighbors and friends and people in my community. So I'm also a Juneau resident, and it's nice to be here talking about what Juneau can do and how we can come together and support each other. AADD is a statewide nonprofit. We're a membership organization, and our members are organizations that provide services. I see some of the leaders in the audience tonight. REACH is a member, TIDES is a member. You think about any of those home and community-based service providers, they're members. And we have about 110 members around the state, rural, urban. And one of the things, I've been in that role for about 3 years, but I did work for almost 20 years at REACH. And so I understand kind of the dynamics of services to people with developmental disabilities. And what I'm going to talk about Terry's given us 10 minutes, is very, very subpopulation of the Medicaid population, and that is people who receive services through a Medicaid waiver. Shannon mentioned it, but it's people with intellectual and developmental disabilities who meet a certain level of care, really people who need a lot of assistance throughout the day. And if those community-based services weren't available, they would need friends, family, potentially, if there's no friends and family, nursing home, hospital, that kind of thing. And one of the things that I love about being at AADD is we are really representing the voice of those folks, those people, and those providers and families. We work very closely with the state. I see some of our partners in the room. It's great to see you here. We work very closely with communities and with our local legislators, who I also see in the room, and also our federal delegation. One of our board members, Sherry McDonald, is here, so Juneau's represented in our board. And we're also part of a national association of providers. And so our national association has a government relations team in Washington, D.C., meeting with people, talking about things like this bill, talking about implementation and what it's going to look like. So, next slide. I'm going to start with good news, because there is good news. And I think it's really important, and I'm glad I see some folks in the room who probably worried about their family member who receives Medicaid waiver services. And the good news is that Alaska is actually, so you go on social media, if you're on Facebook, you will see, and you're part of, and you have friends from other states, you see, oh my goodness, services are going to be cut for sure. And that, it's really important to understand Alaska is the only state that is not going to get a reduction in their federal Medicaid dollars because of the way we finance Medicaid. We don't have any provider-directed or state-directed payments or provider taxes. These are the ways this bill is going to reduce Medicaid. Alaska doesn't have that. So our partners at Department of Health really want us to share that message of like, the federal funds coming in are not going to be impacted. And another thing that is good news is, and Shannon mentioned, there's a lot of exemptions. And one of the exemptions is that parents and people who provide care to people with disabilities are exempt from the work requirements. In Alaska and many states, we don't have enough workers. So we rely on the work, a lot of the workforce actually is parents, some of them being paid to provide the care. And or some of them not paid to provide the care, but because they can't get services. And if all those people suddenly had to walk out the door and get jobs for 20 hours a week, what would we do? We don't have the workers. So that was really a result of advocacy that impacted that. And the last thing I wanted to mention that Terry mentioned is the Rural Health Transformation Fund. I think this is really a lot of due to the work of our federal delegation. So the federal government is going to invest $50 billion in the next 5 years into transforming healthcare. $50 billion, so that's more than $1 billion to Alaska. And I think, I'll talk a little bit more about that later, but that is good news. And one of the things that I have really appreciated is there's a lot of conversation about what can we do with this opportunity? How can we really look? I think that our system of care is really transforming. We're really never going to have enough workers to take care of everybody who's aging and everybody who needs care. We just won't. There's not enough humans. So we really need to look at how does technology leverage what we're doing? And now we're going to have this influx of dollars. How do we use that wisely to help us get to the next level so that we really can help people live the life that they want to live? So that's really the good news. There's a little bit of bad news in my view. So Terry, if you would go to that. The bad news is that and we'll hear more about the Medicaid expansion population. So there will be many Alaskans who lose health care coverage. So if you are a hourly worker and your employer does not provide health insurance, which many disability service providers are not able to afford it, and maybe you rely on Medicaid expansion, you might potentially lose coverage. Or if you rely on the workplace, health insurance marketplace, which we're going to hear about, you might lose coverage. And I worry about that because I think people will decide to leave Alaska because we are the most expensive health care in the country. So I worry about that. People with Medicaid-funded services might have gaps in their care, and Shannon talked a little bit about it. Public assistance, really, they have not recovered since COVID. They really haven't recovered since a reduction in workforce that happened a number of years ago. You probably have read about it in the news. But they are working very hard. We have a Juneau resident who's at the helm working really hard to catch up, but I worry about them. Right now, we have people who have been on Medicaid waivers for many, many years, and suddenly they get a letter from Medicaid saying, oh, you don't have Medicaid. Or maybe the provider that's been providing services for them every day for a month tries to bill that, and the bill is sent back saying, no, they don't have Medicaid. And it's just because they're trying to manage so much and they don't have the system to do that. And so I worry about that because one of the things with the federal bill is that now that Medicaid expansion population, instead of going once a year to reapply for Medicaid, they have to do it every 6 months. And they have to document that they're working. So it just makes that whole system so much harder to manage. And the other thing is, I think we need to be super aware that the cost of providing services is going up. So there's this real push of containing costs in Medicaid. Our state is really struggling budget-wise, and yet wages are going up, insurance is going up, liability insurance is going up, transportation, all the things that go into taking care of people. And so I had to put that in here. Even though the bill doesn't specifically impact that, I think there is a message with the bill around cost of Medicaid and containment that when we talk later tonight about advocacy, I think that's where we might be able to, really come together. So I wanted to talk about that. And then I have one more slide. The opportunities. There's an opportunity. We have time to work to impact things. How are we going to implement these changes that are happening? I didn't even know you guys were going to be here, and I put that in the slide. I just want to say that. Department of Health leaders are partner-oriented. They're in the room, but they are. I mean, I said that. I say that very authentically. The leadership at Department of Health, I think we're really fortunate right now at this time. Right away, they reached out let's get together. Let's talk about this. How are we going to get information to people? What do you guys think we should use with this $1 billion that we're going to get? How should we use that? And I really appreciate that. And I think that people need to be aware that when you're relying on the system and you're at the far end of the machine that makes it work, it can be really frustrating when you get that letter in the mail saying, oh, your Medicaid is lapsed and you turned in your paperwork, you did, and they can't find it. But I will say that the people that are at the top of the system trying to work on it are really trying their best to be partner-oriented. And I also think that there's a lot of talk with the work requirements around how do we develop the workforce for all stuff, but human services as well. Can we get a whole maybe new crop of workers that come from that effort, and can we have good training programs to get people into those jobs? So I think those are some of the opportunities. So, thanks.
Good evening. I won't regurgitate a lot of what has been said about some of the changes to Medicaid, but I will talk a bit about SNAP benefits. So if we could advance actually to the SNAP slide. Okay. But as Terry does that, just a bit about JAMHI. So I'm Will Jemison. I'm the CEO at JAMHI. And JAMHI for the last 40 years has been a behavioral health focused organization, and in the last decade has expanded services into primary care or medical services. And we are a federally qualified health center, which means that we receive federal designation to provide medical services to the broader community. And because of that, we also have a policy of where we do not turn anyone away for ability or lack of ability to pay for services. And so our payer mix is quite varied. We have about 60% of our overall client base that receives Medicaid. We have a substantial percentage also that are privately insured. And then we also have some that pay cash for services because competitively, our prices for services are generally much cheaper than many other providers that are out there because we have that federal designation. And so we also provide significant case management services. So if you know of someone who might be receiving, for example, behavioral health services from us, whether it's residential or outpatient services, we team that individual up with a case manager who will assist them in making sure that every other aspect of their life, they have proper services to assist them as they go forward. And we'll see as we talk this evening how case management and what we're calling now in JAMHI as patient navigators will be even more important to the community as we talk about Medicaid renewals and requalifications. But speaking right now about the SNAP changes, the SNAP changes are expected to go into effect in Alaska on December 31, 2028. And that's important because the state also has an opportunity to ask for a deferral of that. We don't know if the state is going to request it. We don't know if the state is in a position to request that deferral yet. But we are planning as though the Medicaid impact will occur on December 31, 2026, just as we are the SNAP changes taking effect on December 31 of 2028. And so by way of the SNAP changes, work requirements, just like Medicaid, are also going to be impacted and really will impact a large swath of the Juneau community because there will be a number of people who previously, for a number of reasons, were able to qualify for SNAP benefits that will very likely have to go through a renewal process in order to either retain those benefits or have to go through a renewal process that can be very significant on an individual who may not be as well versed in navigating that system. And so making sure that we provide information to those individuals and provide proper support to make sure that they're hitting the requirements for work. We talk about work requirements for Medicaid, but also for SNAP. It's not just for going to a job where you're receiving a paycheck. The requirements that are spelled out could also mean someone goes and takes on an educational opportunity for 80 hours within a month. And so we're, as JAMHI, partnering with social service organizations here in Juneau to create a pathway for our clientele to go to designated agencies to meet that 80-hour per month requirement so that will not be a significant barrier. We understand, too, that Juneau, of course, has a very high tourism industry that is very seasonal. And so we anticipate that there will be some people who might be impacted during the off-tourism season. So we're planning proactively to have programs that are in place to target those individuals who are staying in Juneau after tourism season is over so that they don't lose access to those benefits. And we're also looking at ways to mitigate those who might have a physical ailment that precludes them from hitting the work requirement. And so one of those areas is occupational therapy. We talk about medical exemptions for people who may not be able to work, but unless you really have an occupational therapist who can look at your motor skills, who can qualify that along with your mental or behavioral or physical needs, it becomes very difficult to really qualify someone for a medical exemption for work. And so JAMHI's has one of few occupational therapists that work in Juneau. And so we're fortunate to have that specialty because that would only lend itself to supporting those who we know medically or for behavioral or mental health reasons can't work. And so we're expanding that avenue to ensure that people remain qualified as they need to. And also there will become a limitation on the benefits that SNAP will provide. I've had an opportunity to work in community health in 4 different states. Alaska is the first state that I have been to that, to Kim's point, really has a Department of Health that is accessible to our organizations. Every other state that I have been in, it has been very difficult for organizations like JAMHI and others to really have that partner to work with us. And so, as I've heard in 3 of the states that I've previously worked in, the states have been introducing their own avenues to limit SNAP benefits. And one example of that, and I mentioned to my entire staff this morning, is that states are beginning to restrict what people can use benefits on. And so that becomes a particular challenge for those who might live in food deserts where you don't necessarily have access consistently to fresh fruits, vegetables, and meat. And so it might be you live in a very remote area where the only thing you have is what is able to come in on a plane or a boat that particular week. And some states, if they were to apply that, may not be able to provide SNAP benefits to individuals because those foods that are in stock would not qualify from a very narrow list of things that are approved. And so finding more avenues to make sure that people have the access to things that they need has become a big focus of what we're doing within JAMHI. I'll just elaborate a bit more. Our case management services are adding a patient navigator portion to that. And so by patient navigator services, that means so if someone needs to requalify or renew their access to Medicaid or their Medicaid services or even their SNAP services, starting about 60 days out, the patient navigator will work with that individual to make sure that they are, one, meeting the mandate that exists, whether they have to meet an 80-hour work regimen or they have to meet an 80-hour educational requirement. It could also mean that making sure that if they have a new physical ailment that would prevent them from working, that we have a patient navigator to work with both our medical and our behavioral health sides of our organization to provide the right level of evaluation for that individual and documenting it properly based upon what the Department of Health says that they might need to make a determination on that individual. And these are services that are open to anyone within our community, and so we're being very proactive in doing that. By show of hands, how many individuals in this room receive or have private insurance? Okay, so a good number of you all have private insurance. Well, I have news for you. With these changes, it's not just going to impact individuals who might be on Medicaid. Your private insurance rates are likely to also increase, which means your premiums will also very likely increase. We've just had a check-in with our private insurance provider, which is Primera, which I would imagine services a good number of you all who are in this room, and they're projecting already an increase in our premiums. And so we have anticipated that since first talk of H.R. 1 was presented because as your risk pool will grow, if you lose individuals who have currently under Medicaid and those individuals go uninsured, they eventually will have to seek services in a way that the provider would not be able to recoup those funds. And when that occurs, there becomes a burden on the payers who actually are paying into that system to that provider. And in this case, so if someone goes to the ER, they don't have Medicaid any longer, but they still need the services. The ER is obligated to at least stabilize that individual, but that still comes at a cost. So when it comes at that cost has to be passed on somewhere. So one is going to come on to you as a privately insured person, and then that, of course, is passed on to your private insurer, who will again pass that along to you. So this is not just something that is restricted to those who have Medicaid. This is something that will also impact those on private insurances. So just keep that in mind as we have this discussion. Also, what I see as a benefit or a plus of all of this that we have going on is we're at this table now, 4 different organizations within our community, and we're having a collaborative conversation about how we can work together to mitigate these things. So I see this as a positive of many things that can be perceived as negative. A positive outcome of this is that social service organizations in Juneau and across Alaska are really focused now on how we can all collaborate to serve those individuals within our community who are at most risk. And I see that as something that's going to be a tangible delivery for many, many, many years to come. And lastly, JAMHI is very much focused on the community health worker program. Community health workers who, for those who may not be familiar, are individuals who are embedded in communities, who have gravitas in communities, and who can lend themselves as a voice to those who need services, but for whatever reason, whether it's lack of awareness about services that are available to them or fear of stigma. We oftentimes in our work in behavioral health encounter individuals who have concerns about seeking behavioral health services because of the stigma that's attached to it. But by employing community health workers, these are trusted folks in those communities and those neighborhoods that people know. They know what's going on with grandma, they know what's going on with grandpa and everybody else in the family. And so if someone is in need of services but is fearful to go, they can, in many ways, triage a situation in the home, but then convince them to go for the help that they need. And that comes full circle for a place like JAMHI, where we don't turn anyone away, regardless if they can pay or not. And so we provide that service to them, and we're looking to expand community health workers within Juneau, particularly with the light of these changes that are to come.
Great, thank you, Will. All right, so my name's Anton. I'm a program officer at the Juneau Economic Development Council. I have an office right down there across from Foodland. I mostly specialize in doing research related to policy and economic impact, and we've recently been looking into some of the impacts that H.R. 1 is going to be having on the health insurance marketplace. That is the federal marketplace that was established by the Affordable Care Act originally during the Obama administration. You can probably skip to the next slide. I think that's where I have the... Oh yeah, no problem. All right, if you could go to the next slide, that'd be great. Thank you. You can go ahead. I'll just... Yeah, so marketplace insurance refers to health insurance plans that are obtained through the health insurance marketplace, or healthcare.gov, the website, which was originally established by the Affordable Care Act. Businesses, individuals, and families can go to healthcare.gov. Individuals who are not enrolled in either employer-based healthcare plans or Medicare or Medicaid can shop for and compare various private health insurance plans. They can apply for and enroll in coverage, and they can determine eligibility for advanced premium tax credits and cost-sharing reductions, which help keep the cost of health insurance premiums down significantly. Marketplace coverage is available to U.S. citizens and qualified residents who are not incarcerated or currently enrolled in Medicare. And Medicaid enrollees can enroll within the marketplace, but they are not eligible for premium tax credits or cost-sharing reductions. So what exactly is happening as a result of H.R. 1? Well, there's a few main things here to take note of. The main one being that the enhanced premium tax credits are expiring on January 1st, 2026, barring any sort of congressional intervention. Secondly, automatic enrollment is ending for zero cost and some other marketplace plans, so individuals enrolled in the marketplace are going to be needing to be much more proactive in responding to notices and uploading documents on healthcare.gov. Income and immigration rules are being tightened with more documentation being required, and there is some exclusion within the definition of essential health benefits, specifically for gender-affirming care. So first off, I'm going to go over how enrollment is changing. This is less complex than the enhanced premium tax credit expiration, which I'm going to spend most of my time talking about. So there's a couple big deadlines that you need to be aware of for the upcoming open enrollment period, which begins on November 1st. The first being December 15 for coverage starting on January 1st, 2026, and the second being January 15th is the deadline for plans starting February 1st, 2026. Automatic re-enrollment is also ending for many plans. So this was the process by which your eligibility was automatically re-verified. Now you will be required to go actually, into your profile and manually re-verify your eligibility for marketplace coverage. There's also some changes that are happening to eligibility verification overall, with more documentation being required, like I mentioned. And for the special enrollment period, which I'll get into a little bit later in the presentation as well. Finally, there's some attention that will need to be given to the reconciliation of premium tax credits, which typically there was a 2-year grace period to reconcile the tax credits that you received within any given year. That's now being shortened to 1 year. So if you fail to reconcile your tax credits within the year, you will lose coverage. So a little bit on enhanced premium tax credits, which is the main change that's resulting from the H.R. 1 reconciliation bill. So these were originally signed into law in 2020 as part of the American Rescue Plan in response to the COVID pandemic. These essentially offer larger subsidies compared to original Affordable Care Act levels, and they expand eligibility to individuals making above 400% above the federal poverty line. So the amount of assistance that you receive within the marketplace is determined by your income level within your household, which is in relation to the federal poverty line. So prior to the establishment of enhanced premium tax credits, there was this thing called the subsidy cliff, which referred to the fact that after you make above 400% above the federal poverty line, you could even make 401% above the federal poverty line. If you make above that level at all, you are not eligible for subsidies whatsoever. So for a lot of people, that can be the difference between paying $250 per month and then paying $1,500 per month. So the most adversely affected group are definitely going to be those income earners above 400% above the federal poverty line, but there are also reductions in the subsidy amounts for other income tracks as well. It's going to basically revert back to the original ACA levels. So to receive these, the way that these tax credits work is that basically eligible enrollees contribute a certain percentage of their income, depending on their federal poverty level, their household size, health factors, et cetera, toward their plan's premium, while the rest is subsidized by the government. These credits help keep cost insurance affordable for a lot of people, especially for, like we mentioned, those individuals that earn above 400% above the federal poverty level. And who benefits from these enhanced premium tax credits? Mostly it is people who are not dependent on other forms of insurance, obviously. These include self-employed individuals, gig workers, seasonal workers, part-time workers, business owners, early retirees who are not yet eligible for Medicare, and others who, for one reason or another, can't access either an employer-based plan or some other form of federal assistance. So here's some statistics for Juneau, Alaska, just to illustrate a little bit of the reduction that enhanced premium tax credits really have in terms of the premium that you have to pay every month. Before annual premium tax credits, advanced premium tax credits are applied, the average marketplace premium in Juneau within the year 2025 was over $1,000, and that's before any deductible or out-of-pocket maximum kicks in. That's just the cost to maintain your coverage. And among receivers of these advanced premium tax credits, the average monthly premium was only $124. So I think everyone can see how that goes from a very unaffordable scenario on the one hand to all of a sudden being able to afford health insurance coverage. There are almost 1,400 marketplace enrollees in Juneau. These are individuals who selected a plan on the Alaska marketplace. And right here I have some statistics, I got some statistics on where people fall in terms of their income tract. So we can kind of see here that it's pretty evenly distributed, but the most of the enrollees are above 400% above the federal poverty level. So for all of those individuals, they stand to lose subsidies entirely, which potentially could make health insurance unaffordable. Go to the next slide here. So here I have some tables just to kind of concretize this stuff a little bit for everyone. This is the 2025 Alaska federal poverty levels. It is important to note that Alaska has 25% higher federal poverty levels than the contiguous US. So just if you're referring to these numbers online or anywhere, just make sure that you're looking for Alaska-specific numbers. But this shows, for a household of up to 6 individuals, it goes beyond 6, but for the sake of room, I just kept it at 6. These are basically the amounts that are the cutoff for each federal poverty level. So you can see that an individual making, I don't have the updated, $78,200 for an individual. Just on my handout, it wasn't. Yeah, sorry about that. But if you make above that amount, you would no longer be eligible for these subsidies. Then we can probably go to the next slide here. Nice. So this is some more concrete numbers here. Keep in mind that this is more of an illustrative example. The amount that you pay toward your premium depends on a ton of factors, like your specific risk factors, like age, tobacco use, the state that you're in, the type of plan that you select. There are different tiers within the marketplace plans, gold, silver, and bronze, and other factors. So, don't take these numbers as gospel, but this is just meant to illustrate kind of the potential increases that individuals at various levels could face as a result of the elimination of the enhanced premium tax credit. So we can see here that for those individuals below 400% above the federal poverty line, they will still be retaining some level of subsidies, but that will be a reduced level. So we can see here that an individual making 150% above the federal poverty line would go from paying $1 a month for the second lowest silver plan, which is their benchmark plan that we use for analysis, to paying $72 a month. So while that may not seem like a whole lot for an individual, not earning a lot of money, that could be a huge hindrance to, housing, food, essential needs. And then if we could go to the next slide as well. Thank you. And here are some more scenarios to put some concrete numbers in front of you guys. So the scenarios in the leftmost column, and you can see the change in the annual cost in the rightmost column. So for a family of, obviously the most eye-catching thing here is that for a family of 4 at 500% above the federal poverty level, they would go from paying about $885 a month to paying almost $3,000 a month just for their premium. So that's an annual change of almost $25,000, and that will severely impact individuals earning that level of income, their ability to spend it on other essential things or just participate in the local economy. But even for a single individual, a low-income single individual, they will still see changes, not insignificant changes to the cost of their health insurance coverage. So, at the Juneau Economic Development Council, we are concerned with the overall economy, which obviously healthcare is a major part of. But when changes like this come down the pipeline, it has a ripple effect and obviously has an economic impact that we are concerned about. The most obvious being higher premium costs, which my fellow panelists spoke a little bit on. Just lower enrollment resulting in the need for health insurers to charge higher premiums, essentially. But also the strain on local hospitals and healthcare providers. I know that someone at Bartlett Regional Hospital recently made a statement about how they're concerned about the potential impact that the having less of an insured population would have on the hospital system, not only financially due to inevitably having to provide more charity care and being able to recuperate less of your services, but also just in terms of wait times in the local emergency room, because where do people who aren't insured go? If not primary care doctors, they typically seek care if they really need it within the emergency room. And obviously that it benefits nobody to have an emergency room that has an outsized burden on the staff. So that's another potential issue that we're worried about. There's an impact on the workforce. As economists, we like to see a healthy workforce because that means that more people can participate in the economy and have jobs. With these plans becoming so expensive and the potential for individuals to, just forego coverage altogether, because if you're faced with the decision of paying $30,000 a year just in premiums for your family versus taking the risk and just hoping that you don't have a catastrophic medical event happen within the year, that might honestly be a difficult calculus for a lot of people, and a lot of people might end up choosing to forego coverage entirely, just because it puts too much of an economic burden on them. So that's another concern. We're also concerned about the impact on entrepreneurship and new business formation. We see there's a lot of research out there that indicates a large increase in entrepreneurship activity when programs like the Affordable Care Act and on top of it the enhanced premium tax credits, when these things exist kind of as a security net. So if you don't have an employer, you can still manage coverage for yourself and take that risk to try to start a new business or a new venture without worrying about going bankrupt if you break your arm. That's another huge thing that we're worried about at JEDC. Additionally, there will be a strain on social services as a result of some of the enrollment verification tightening. So individuals who maybe aren't proficient in English or maybe aren't proficient technologically, it's going to be a struggle for them to navigate some of the new enrollment requirements, which will probably either, it could potentially kick them off of coverage, but also put a greater strain on the local services that help support those individuals. So something like automatic re-enrollment, for example, just makes it a lot easier for people to not have to worry about going back in and uploading documents and responding to notices and everything. They can kind of just coast. But since that's ending, there's going to be a lot more proactivity required on the part of the subscriber. And then a general suppression of economic activity. When just to put it simply, when people are spending a huge percentage of their paycheck on their health care costs, they can't spend it on goods and services in town, which suppresses economic activity and isn't good for the overall economy. We want people to be working and spending money and generating economic activity, but when this just places another huge burden on people's ability to spend their money in other arenas besides health insurance. And finally, there are some public health concerns, relating to the prevention of communicable diseases, for example, vaccination, things like that. Just the fact that people are going to be less likely to seek care for minor ailments if they aren't insured could lead to those ailments becoming more severe or having an impact on whatever work or activities they partake in. That's it.
So I want to thank the panelists for the presentations and the overviews. That very, very great information and also very informative. And I think that there was a lot of information to try to understand, but we do have some handouts on the back table that do some drill down. So things that were mentioned up here, you can see it in writing back here, and we're also going to put it on the AK Advocates website for future reference, so you can get it digitally as well. But that's not the end of the presentation. We want to go now and we have some questions we're going to ask the panelists that they're going to answer in whatever order you want, popcorn style, just whoever wants to answer the question. We did talk about audience questions, and we decided that the best thing would be to either stay after, if you have specific questions, or more importantly, you can get the information from the organizations, and you can contact the organizations directly and get your questions answered that way. So if we could go ahead and let me ask the first question. And by the way, there's one on here that I didn't ask, I didn't write down, related to advocacy, and we'll talk about that a little bit later. Excuse me. All right, so let's look at the first question. If, again, whoever wants to go first, feel free. Describe some of the impacts to the community if a portion of its citizens are no longer insured. Impacts to hospitals, doctors, business owners, contractors. And I know you have already touched on this, but if there was something missing that you didn't mention that you want to mention, or we can just skip the question too if it's already been answered. But hold the mic real close to you.
Okay, well, I'll touch on it. In this, I'll start before the impacts of this act take effect. the last few years, we've seen a decrease in, and I'm going to talk about Medicare for a second. Okay. Yeah. All right. I'm going to talk about Medicare for a second. The reimbursement rates to physicians has decreased over the last few years, and just this past January decreased again. And each year we've seen a number of private physicians who are in private practice who have stopped either accepting Medicare patients or severely limiting the number of Medicare patients that they would have on their patient roster. What I see is with these changes and the uncertainty that comes with it, there's a cost to a provider for having whatever sort of insurance someone might be on, whether it's private insurance, Medicaid, or Medicare. There's a cost to the provider. We have to go through every single year and negotiate what the rates are with those providers, and it takes a substantial amount of time, a lot of effort, and a lot of money to do so. What I foresee happening is Juneau already has a lack of medical providers. And when it gets to a point, or if it gets to a point where it costs, the cost benefit is not there, you're going to see more providers either refuse to take certain types of insurance. They might move themselves out of the federal insurance realm and only do private insurance. We've seen a trend across the United States of physicians moving away from insurance altogether and either going on a cash basis or moving to what we call direct care plans, so that it's more of a subscription model for healthcare. And so I foresee that being something that could very well happen, particularly amongst our private practices within the community, because when you factor in the cost to operate a private practice and the liability insurance and the malpractice insurance and the staffing, it becomes a significant barrier to provide services in a place like Juneau, which somewhat has a stagnant population growth. And so either you have to make a determination of whether you're going to maintain services or you're going to switch the plan altogether, and that could have a significant impact on individuals. As I mentioned before, JAMHI has about a 60% payer mix of Medicaid individuals. So we're already beginning to see individuals who previously had only gone to private practices for services are now coming to JAMHI as a federally qualified health center because either their previous physician is no longer accepting their type of insurance or the services that they need are too costly for that provider to provide. And I only see that happening, I see that happening across the spectrum, really, because the hospital at some point is going to experience that. And so we have to be very aware of how these changes impact the providers. And that we don't risk losing providers in the community. So what JAMHI's doing is offering more support to the hospital as a primary care provider. And Anton talked about it. You know, people who have recurring conditions or chronic conditions, they can certainly come to a primary care provider and get the type of treatment that they need that would mitigate them going to the emergency room at the hospital and keeping that cost down. So what I see is more of a shift in the type of providers that people will seek out and more collaboration, again, in how we all work together to make sure that more chronic conditions are treated in advance and are not allowed to fester so that that cost can be avoided by all means.
Very good, thank you. Yep.
That was great. Thanks, Will. I just want to point out, one of the things that all these things are so interconnected, right? So if you have people who aren't insured seeking out health care, it's going to increase the cost. If people with disabilities don't have quality support in the community and they end up in hospitals and the hospital then is ready to discharge that person to the community, this is happening in our system as well. Like so the hospital they can't discharge somebody to the street who's absolutely unable to care for themselves, but nobody will take that person. So they stay in the hospital longer than they need to and longer than the hospital will pay. It increases the cost, right? And then by the time they find somebody to provide support to the person, that person is moving back into the community, but they've been hospitalized. Now they have to get used to being in the community, and there's the skill level needed to support somebody is higher. Like, it just, when you were talking, it's all of these things are so interconnected. So if you have people without insurance, it's going to ripple effect to our own private health insurance. And I guess that just really struck me. I do wish it would be great to be able to have some dialogue about that, but I think it's important for us all as just community members to think about every decision, every advocacy, every vote we make. It really does have kind of a trickle-down effect that will impact all of us. So, yeah.
Anton.
Yeah, I just wanted to speak a little bit to something that Kim, I actually think you mentioned earlier regarding individuals making the decision to leave Juneau or leave Alaska as a result of some of these changes because of the outsized costs that you see in our state compared to other areas of the U.S. I think, we're concerned right now at JEDC about outmigration. If you look at the migration statistics over the past 10, 20 years, we have been seeing net outmigration, and we've been seeing a decline in population, specifically working age population, over the past 10 or 20 years as well. Juneau is a very aging community. I believe in the past 2 or 3 years, for the first time in Juneau's history, the age cohort aged 60 plus outsized the age cohort aged 18 and under. So we're seeing really significant changes in the demographics within Juneau, which makes it all the more important to take action to retain and attract individuals who are of working age and are skilled and want to come and start businesses and produce economic activity to our state and our community. Changes that are being made, like those being made to the marketplace insurance, are going to have a really adverse effect in that arena. And I think that's just another worry on top of the trend that we're already seeing that could potentially exacerbate things.
And just one final piece to add, obviously there's a lot of financial cost too, but I think there's a secondary cost that could be to public health from this. We already see people that come into our offices that are scared to go get medical care because they don't know if it's covered right now. So I think that uncertainty and unclarity is going to continue in the future. And if they're not getting their ailments seen early, it's going to be a bigger cost down the road. So I think that's another consideration to think about.
Great. Any follow-up, or should I go into the next question? Did you have? Okay. All right. So, excuse me. Thank you for that set of answers. The second question that we had, again, anyone can answer. How can individuals and/or organizations collaborate to mitigate some of the impacts of these changes to healthcare coverage? And I'm probably talking about local organizations, but if you want to mention the state, that works too.
Well, some of the thoughts I had is really thinking outside the box and maybe doing things different. I actually made a note about community health workers, right? What if we really had a lot of community health workers that could do outreach to people? I had thought maybe like AARP has the volunteers who help people with their taxes at the library. What if there was a community volunteer who got trained on helping people fill out their Medicaid paperwork? That's at the library every Friday, or businesses have people on their employees that get trained in some of the system navigation, and they're the go-to person for someone to answer insurance questions. Because you can see one of the themes is that if we can keep Medicaid, Medicare, and the private insurance, if we can keep everybody covered, it's going to really benefit all of us. So that was one of the things. I also love the idea of JAMHI already thinking about how do we help people meet these work requirements? We know they're going to have them. How can we kind of shepherd that? Well, could there be relationships where maybe a disability provider organization who needs direct support professionals seasonally or on call could maybe be in partnership with JAMHI and kind of look at, are there opportunities there to find workforce? So I think there are some real things that will bring us together to kind of think about stuff like that.
And I would say that a couple of big things, and I think this panel is part of this, is just raising awareness within the community about these changes. You do want to be aware of things like enrollment ending, because you will want to be going online and double checking your enrollment status. And if people aren't aware of these changes, they might just assume that everything's the same as it always has been and end up kicked off outside of the enrollment period and be in a really bad situation. So that's the first thing I think is raising awareness and really educating people about where they stand and how they might be affected. I think the other piece is advocacy. These changes to the health insurance marketplace and the elimination of the enhanced premium tax credits, these aren't set in stone, basically, specifically for the enhanced premium tax credits. They're basically just not being continued past 2025. They're expiring because the prior legislation only extended them through the end of 2025. So there is still a possibility that at the congressional, the federal level, they pass some sort of extension to these enhanced premium tax credits, which would obviously benefit millions and millions of Americans and tens of thousands of Alaskans. So I would just encourage people, if you are affected, or just if you care about this issue, to reach out to the Alaska congressional delegation, and that's Senator Sullivan, Senator Murkowski, Congressman Begich, and just make your voice heard and encourage, tell them about how these changes will affect you and your community and your state, and just try to advocate for some sort of extension to these enhanced premium tax credits, because there is still a possibility, and this could have a huge effect, not just on our community, but the country as a whole.
Anyone else have an answer for that question?
Yeah, I'll
Sure.
just add to that, and this is where business comes into focus, is partnering with businesses. So there are a number of businesses in Juneau that, because of the size of the organization and number of people that they employ, they don't have to provide group medical coverage for individuals. So they have a mix of employees who might be Medicaid eligible or receiving some sort of other benefit to cover their insurance. And so partnering with local businesses to let their employees know what options that they have out there, and that, yes, you might be employed, to the benefit or just to the degree that you're able to maintain, say, a Medicaid benefit, but what avenues do you have to really get the level of care that you need? Medicaid only goes so far. And so making sure that people are aware of preventive services so that they can always have access to the type of chronic care that they need, that you're not going to receive from going to an ER. And that it is, in and of itself, is a cost savings in the long run. And so collaborating, all of these partners here and a number of partners who are in this room today, to really create that pathway of information so that people across the community know what their real options are. I think oftentimes people don't know what all is available out there, and it's really incumbent upon us to let them know what's there. And I think, now with this act in place, is really having us to go back and really demonstrate community collaboration.
Great. That's wonderful. Thank you. Shannon, did you pass on that one? Okay, great. Yeah, thank you. And I did want to ask about advocacy, since that's, are there any other advocacy efforts that could be done? You mentioned contacting the congressional delegation about the enhanced premium tax credits, which are expiring and which also have an opportunity to change. But maybe for some of the other provisions of the federal changes that are happening, that the deal is sort of done. Maybe is there still some advocacy that could be done? Is just maybe touch on that.
Short answer, yes. I think there's a huge opportunity for advocacy, especially when we're thinking about these exemptions and how these exemptions are going to take place, how they're going to be administered, who's going to determine that, how are they going to be processed. Kim had talked earlier about these gaps in coverage for Medicaid, and I think as the state sorts through and looks at what other states are doing as they implement these changes before the state of Alaska, it's going to be really critical for us to really intentionally think about how we're implementing these exemptions, who's going to be having that administrative and reporting burden of doing the work behind to make sure that those exemptions are happening and that there's not gaps in coverage.
I'll just quickly add, that's a great point. As things are implemented, for example, there's been some conversation is, could the work requirement just be a self-attestation, right? Somebody has to sign saying, yes, I am working, instead of having to submit like pay stubs and, that kind of thing. And I know that the state wants to make it as streamlined as possible. So, making sure that we really talk a lot about that. I also think that there's a legislative opportunity. I mean, our legislature does determine, what's funded and where do we invest. And we need to think about the fact that the state needs a workforce to implement these changes and have the time to do it right. So, the Department of Health capacity to manage this. There's a hiring freeze right now. It's really challenging when there's these big asks that are coming down from the federal government. And public assistance. Sharing stories. If you are, I know there are family members, people who provide services in here, it makes a difference to show up when there's budget testimony, meeting with our people who are here in this room tonight listening, and they're like our biggest champions. We're fortunate in Juneau, but they need stories. They need things to share with their colleagues to help make these things happen. So I do think that there's advocacy around, that health insurance is important. Medicaid and Medicare are important. We need to invest in the capacity of the state system so that we can really do these changes well and make sure that we're doing the least amount of administrative burden as we can.
Anything else on that topic? Okay, so our fourth question is, what are some of the opportunities resulting from the federal changes? How will Alaska benefit? Well, I know you mentioned, Kim, the Rural Health Transformation Fund. Maybe let's talk a little bit about some of the opportunities that we might have moving forward.
So this $1 billion, the state of Alaska put out a request for information, and some organizations put in their thoughts. A lot of organizations put in their thoughts. And I mean, things like really expanding the ADRCs and DDRCs and their work, and being able to maybe tie them in directly with public assistance. Like, what if there was a public assistant worker who sat in Shannon's office and they managed Medicaid, applications and eligibility right there in the room? I mean, potentially, or with technology. I have a whole list of so many things, but one of the things being talked about are regional plans and community plans that could be funded from this health transformation. So if Juneau came together and said, what would we like our healthcare system to look like 5 years from now? Who are all the players, and what can we build out? What technology do we need? What training do we need? Do we need some housing? One of the thoughts we had was housing is part of a healthcare transformation. What if we had housing for itinerant workers where we could get certain medical specialists or traveling direct support professionals from other states who want to come and spend their summer in Alaska? How can we be really innovative? I also know there's conversations going on around really doing more integrated care. JAMHI, you heard, they are primary care and behavioral health. That is so great. And what if we had developmental disabilities into that mix as well? Where people could have a team of people who kind of collaborate together around the needs of a person in a really, effective way. I mean, I think that there's really a lot of opportunities when we think about having these resources and what we can do with them.
Yeah, and I'll touch on the Rural Health Transformation Fund as well. And I just want to give another shout out to our Department of Health. Within days of H.R. 1 taking effect, we had a communication from the Department of Health about preparing for Rural Health Transformation Fund so that we can begin putting together our ideas and putting them on paper to come up with a way to really maximize this opportunity for funding to really support our community. One of the things that from a medical sense that we're looking at is expanding access to telehealth. I don't know any person that doesn't have a cell phone. And so you now can have full medical visits with your cell phone. The challenge is you have certain pockets of the state, even within this region of Southeast, that don't have the network capabilities to support a video medical visit. But there's certainly a need for it. And so one of the things that we're looking at is expanding that telehealth service, but also providing the infrastructure to support that telehealth service for our most remote areas across Southeast, because those individuals deserve access to medical care as well. And so making sure that we partner with organizations, and Kim just mentioned, working with other community partners to really bring under this umbrella of integrated care disability services. And so leveraging all of those things, we have a very unique opportunity right now with this Rural Health Transformation Fund to really bring under a common umbrella so many distinct areas of healthcare that have been separated for too long that really have an opportunity to come together and have a really lasting impact. So JAMHI's working with a couple of organizations within Juneau with the Rural Health Transformation Fund, and we've submitted a joint proposal for it. We're also partnering with the Alaska Primary Care Association. What we're doing with the Alaska Primary Care Association is creating an interweb, so to speak, of primary care providers across the state. There are 29 community health centers or federally qualified health centers in Alaska. And so creating a network of us so that if someone might be in Juneau for tourist season but lives the rest of the year in Seward or in another part of the state, their medical information in very real time would transfer with them. And so we can have a continual loop of information so that we cover that person's care across whatever city that they're living in. We can cover that. And then also having the ability for our providers at our respective locations to regularly communicate and have an opportunity to talk about, well, I'm seeing this in this part of the state. You guys might want to prepare because we can only imagine that it's coming your way. Oftentimes what happens in medical care is there's a problem in one particular area and we may not see it for several months or even several years, but eventually it's going to make it there. We experienced that, and probably the most notable example of that is COVID. COVID started in one particular part of the United States and eventually spread everywhere. And so having awareness of what's happening in other parts of the state so that we can be more proactive really will lend itself to better health outcomes at the end of the day. And I see this as a big tangible of this rural healthcare transformation.
Thank you for those answers. I appreciate the hopefulness that you're expressing, and especially with the rural, whatever it's called, transportation or what transformation. I'm sorry, it's all dyslexia in my brain. Okay, good. Well, thank you for that, for those answers. I also want to ask about community members, like individuals. People in the community who don't belong to an organization, but what could they do to support each other or to support the organizations moving forward? And I know, Kim, you touched on that. A couple of you touched on things that individuals could do, but maybe you have some other ideas, other people. Yeah, go for it.
Yeah, I would just say, kind of along similar lines to what I mentioned previously, just try to be really aware of those individuals in your life, whether it's family, friends, acquaintances, who could be adversely affected by these changes and may not be aware of the impacts, and that might impact their ability to budget ahead, plan ahead, make certain decisions that might affect their health outcomes in the next several years. So I just want to, emphasize that piece of just spreading awareness, talking to individuals in your life that might be affected by some of these changes, and helping to be a conduit for this information to filter through the community. Obviously, we do have some great community resources out there. JEDC is one of those. So if there's anyone out there that has questions about, wants help navigating or planning for the next year, specifically with these enhanced premium tax credits expiring, feel free to send us an email or give us a call. info@jedc.org. It should be on the handout that we have back there, and we'd be happy to help work with you to kind of help on a more individual level understand and navigate some of the changes going forward.
I think just showing up here tonight, but if we do have a community meeting about working as a community to collaborate on what could our future look like, I think if you are, I know there are people who are volunteers on nonprofit boards in this room tonight, but consider being on a nonprofit board. I do think that there is a need to kind of rise up during this time and think about like, what could I do to help the whole? And I really did appreciate what Anton said about, think about the people in your life and what their needs are, and maybe share this information. Maybe you know families who receive services from a Medicaid waiver who are really worried, and you can say, hey, I heard that we're going to be okay, but just really work on your public assistance eligibility or whatever the message is. So.
Yeah, I would just say, to echo Anton and Kim, is if you see something, say something. We all know individuals who have very precarious, whether financial or medical concerns or needs. I would say for all of our organizations up here, just mention our organization's name to them and just say, well, if you have any additional questions, if it's something that you can't answer yourself, we're more than happy to answer the questions for them. At JAMHI, I have an entire department that are prepared to answer questions that people may just have, whether they're a patient of ours or not. We just want people to be informed about what their options are that exist, and we're happy to help facilitate that.
Yeah, very similar to what everyone has said. I think it can be tempting sometimes to close our eyes tight and put our heads under our pillows, but keep your eyes open, stay engaged, stay informed, and just completely echoing what everyone has said already of looking out for those people in your life that this is going to influence, and not being afraid to ask questions and reach out to organizations that can support them.
Great. Well, we're pretty much ahead of schedule. I do have one final question, which is sort of a wrap-up type of question, but I also wanted to ask if you had any comments, or if you want to answer your own question right now. I mean, if there was something that you wanted to say that you didn't get to say, this might be a good time to just you give that comment, and then we have our closing question. Anything?
Yeah, I would just have a couple more words to say. I know that when I talked about the health insurance marketplace coverage, it was mostly about the enhanced premium tax credits, and the expiration of those is going to have the greatest effect on the greatest number of people. But there are also some provisions within the bill that will affect some other groups on a slightly smaller level. Those included being individuals who receive gender-affirming care, so that is being removed from the definition of essential health benefits, and will no longer be covered by many plans. So it will be important for those individuals to seek out the explanation of benefits for their plan to ensure that their needs are still being maintained. Additionally, there is going to be a lack of eligibility going forward for individuals. Basically, the definition of legal status is being more restricted. So individuals on I think it's deferred action childhood arrivals, DACA recipients, and some other temporary protected status, asylees, refugees, also may stand to either lose access to marketplace coverage altogether or just lose access to these premium tax credits. So I just wanted to emphasize that this isn't just the only effect isn't the expiration of these tax credits, but there are also other provisions that will affect groups, not as broadly, but still significantly.
Yeah, I would say we also need to talk about the impact of these changes, particularly in the realm of Medicaid, to senior citizens. Medicaid is one of the biggest payers for nursing homes in the country. That's not really a Medicare function. I think oftentimes we don't think about how these Medicaid changes will impact those who might be in some sort of residential care. And that becomes pretty impacted in a place like Juneau, where you have a high number of individuals who need that level of care, but may not have an immediate family that's around to take care of them in the event they cannot remain in that nursing home or residential care. And so we need to have an open conversation also to our senior population about how these Medicaid changes could impact them. I think we oftentimes think about this and frame this in the idea of we're talking about working individuals and younger people, but this also will have a trickle-down impact on those who are seniors who are outside of the working population by age. And so we have to also talk about how that impacts it, and then how we as community partners help responding to that. At JAMHI, we're working now, and our chief medical officer is here, Dr. Smash, are working on ways to directly target our aging population for services, because we can only foresee that as these changes take effect, it's going to impact that population very disproportionately within our community.
Very good. That's a point. That's a great point. Thanks for bringing that up. Another thought, another comment before we? Great. Thanks, Will. Okay, so for our last question, I want to thank everyone for coming out and paying attention to this. We will have some information on the website, which is akadvocates.net. There's some business cards, my business cards back there with the website, email, if you're interested and want to get on our distribution list. Or if you want more information, there's also a sign-up sheet back there. You can just add your name and your email, and we'll make sure that you get information as it comes out. We don't do weekly alerts or anything. It's not a very robust response, but you can also use the web or the email to ask questions, sort of, as well as the emails of each of the panelists and their information is back there too. And since we are going to be ending a little early, maybe you'll come down on the floor and people can ask you some specific questions. That'd be great. Okay, so for the last question, what is the one message you hope people will take away from this panel tonight, from this, from this event? Yeah, that would be my question. And just jump in.
I think one message to take away is, while there's a lot of uncertainty and there's big changes that are coming, that we have a great community here in Southeast Alaska and our community partners. People are engaged, people want to collaborate, and like, you're not alone in navigating this, that we're all in this murkiness together, and we're all going to be here to support each other as we navigate through the next few years.
I just want to say ditto. No, I just think we need to, I think that there is power in unity, and Juneau is a special place. We're very tight. We work together. Alaska is that way. We work with our state partners, and I think that people are starting to talk about how do we move through this together. So.
Yeah, just again to echo, this is going to be something that impacts everyone across the community, both young and a little less younger. And the way that we can respond to it, to me, is by just being informed. Coming to events like this, visiting our respective websites, for example, or if you know someone who needs the service and they're just not 100% sure exactly what service they need, to reach out to us. We're more than happy to, as collaborative partners, to direct people to other providers. If it's something that JAMHI may not be able to provide, I'm certain SAIL probably could provide it, and a myriad of other providers. So just know that the resources are out there, and we're more than happy to always share. So please just inform others. Each one teach one.
Yeah, thanks. I would echo what my fellow panelists have said in terms of staying informed and keeping attentive to the developments that happen in this arena. But I also wanted to talk about this for individuals who might not be directly affected by some of these changes. Like, let's say you don't enroll in Marketplace health insurance coverage, but I just want people to be aware of the fact that we live in a network, and that impacts to one industry like the healthcare industry are going to have ripple effects throughout the broader economy and our community. For example, the loss of enhanced premium tax credits, an analysis, I think, by the state Department of Insurance, found that almost $300 million annually would basically be removed from the state's economy, and those would otherwise be subsidies that individuals within the state would be receiving from the federal government. So, this is going to have a big impact within the local economy, the state economy, and the, national economy as well. And this isn't something that just affects individuals who directly enroll in these programs, but it's also going to affect and have ripple effects to everyone. And I think everyone's going to feel these effects in one way or another, whether you have a family member who's affected or a friend who's affected, or whether or not some costs for your, for your health insurance, your private health insurance go up. There will be effects that are felt from all, I think, members of society, that we should really be looking at this as a holistic issue, that we're all kind of in this together in that sense.
Thank you to everyone for coming tonight, and also thank you for coming as well. Thank you for the community. And I want to point out that Representative Story is here, Senator Keel is here. These are your legislators who are working in Juneau to. Did I miss any other legislators or city assembly members? I'm sorry. I don't know your name. Please. Maureen what? Maureen Hall. I'm so sorry. I think you're my neighbor, but Maureen Hall. I know your name, but I just didn't recognize your face. Maureen Hall, an assembly person. Thank you for coming tonight, too. And again, thank you for coming. And if you are interested in advocacy, talking to policymakers, again, put your name on that distribution list, because that's one of the things AK Advocates does, is we get the voices of community members to the policymakers. That's our goal. So if you want to be a community voice that accesses policymakers, please put your name on the list. And thank you again for coming, and thanks to the panelists. One more time, how about if we give them a hand? And thank you.
And shout out to Terry for organizing everything as well.
Thank you.